SDT Times Explainer. I am Aditi from the Faculty of Dental Sciences. Today we'll discuss how H5N1 bird flu in mammals raises concerns about viral transmission to humans. The H5N1 type of avian influenza bird flu, an outbreak that began in 2020, has reached record levels, impacting millions of animals. The regular ebb and flow of infection have given place to a permanently increased level in wild birds as the virus mutates genetically and travels geographically. They are infecting domesticated fowl and a growing variety of animals, including badgers, bears, ferrets, and raccoons, as well as a few humans. Even though the virus has been present for decades, there is no evidence that it has led to human transmission. Nonetheless, it may mutate further to cause catastrophic epidemics in humans, just as the world is going beyond the worst of the COVID-19 pandemic. What is the frequency of avian flu? According to the Center for Disease Control and Prevention, avian influenza has impacted almost 60 million birds in the United States alone, including wildlife, commercial poultry, and private flocks since January 2022. This is in addition to the 50 million birds that will be slaughtered in 36 European nations between October 2021 and September 2022. It is not just birds either. Since the beginning of 2022, there have been 10 reports of infections in non-avian species in the United Kingdom, including red foxes, Eurasian otters, and harbor seals. Is avian flu dangerous to humans? According to the World Health Organization, there were only 9 verified human cases from 2020 to 2022, including one in the United States and one in the United Kingdom. One instance was recorded in Ecuador in January and another in Cambodia in February of this year. These usually included someone who had close touch with ill birds. According to the CDC, the viruses that are now circulating do not contain genetically alterations that have historically been linked to infecting individuals more easily or causing severe disease. These, for example, cannot easily bind to human respiratory tract receptors. Even in an epidemic last year at a Spanish mink farm, when more than 50,000 animals were destroyed, there was no trace of illness amongst almost a dozen personnel. The European Food Safety Authority produced an expert study in January that rated the risk for the general public as low, as did the WHO, but advocated continuing cautious surveillance. So, what's the big deal? The concern is that the flu strain identified in poultry might merge one with present in people, resulting in a new variant that spreads quickly from person to person. While there is no proof of this happening, there are indications that the avian flu has spread to other animals. After the mink farm incident, a paper presented data showing the animals might act as a mixing vessel for interspecies transmission. More than 500 sea ant lions died from this virus in Peru earlier this year, indicating that the virus is spreading more easily among animals. Rising animal populations may result in more people becoming infected. While human instances are still uncommon today, the mortality rate among individuals who have experienced them in the past is alarming. From 2003 to 2019, 457 of the 868 persons afflicted died. Since infections aren't always detected until the patient is plainly ill, milder instances may go unnoticed, skewing the death rate. What are the signs and symptoms? These can range from no evidence sickness in ducks to multiple organ collapse and 100% death in hens within days. If any bird in a domesticated flock tests positive for the virus, the entire flock is swiftly culled, slaughtered, to prevent this illness from spreading. Surrounding flocks are being watched attentively. Mammalian infections have resulted in some surprising symptoms. Last year, 3 grizzly bears in Montana were killed after being discovered confused and blind. Testing later revealed that they were infected with avian flu. The sea lions were convulsing and had difficulty in swimming. The minks had hunger loss, sadness, bloodied snouts, and neurological abnormalities such as lack of coordination, difficulty walking, and tremors. H5N1 has produced symptoms ranging from minor eye and respiratory infections to severe pneumonia in people. Is the threat becoming worse? Avian influenza has been around for almost a century, initially being characterized as the bird plague in northern Italy in 1878. Yet it was the finding of highly pathogenic H5N1 strain among geese being farmed on a farm in southern China in 1996 that sparked widespread concerns. While the current outbreaks are mostly an animal health concern, The CDC stated that it is actively watching the situation, planning for future risks, and taking preventive measures, including work on a possible vaccination. Antibiotics, antivirals, vaccinations, and other techniques to manage outbreaks minimize the risk, but it is vital to detect end human infections as soon as feasible. So, what are the consequences? The impact is already seen in supermarkets. A dozen eggs in the United States have more than doubled in price over the last year, reaching an average of $4.82 in January, more than a pound of pork chops or minced beef. The financial impacts extends to chicken and turkey growers as well. By February, the US government had spent around $661 million on cleanup and compensation for farms affected by the current pandemic. According to one estimate, a 2015 epidemic in the United States resulted in more than $3.3 billion in damages, even though fewer birds were killed. The expansion might give urgency to calls for less intensive cattle production and pose a hazard to wildlife conservation efforts. That's all for today in SGD Times Explainer. Thanks for watching.